Dr. Deepak's Special Officer of Trauma Care Center, which is a 200-bedded facility in the Victoria Hospital campus, and he's our Dr. Ramesh Shavana is a nodal officer, and Dr. Vijay Kumar is a critical care consultant and the head of the department. Here I am happy to welcome you all to have some information about the new DOSI, that million ICU system, what we incorporated in our setup, and especially in the COVID times. So in the last 2 years, I think we have seen around 12,000 patients in the whole of Victoria Hospital campus, and ours was the first COVID hospital, designated state COVID hospital in the state, and the amount of serious cases coming here, it was a tremendous pressure on us, and we were having difficulty to maintain and monitor the patients very effectively. And I think at the end of first wave or beginning of second wave, we introduced this DOSI system into our system. This DOSI system is the one where we can monitor all the vital parameters by attaching a gadget to each of the beds and monitor at the central monitoring system. So this will help in many ways to monitor many patients at a single place with minimal HR personnel, especially in the times where many of our healthcare personnel were scared to go inside the wards wearing PPE kits and all, one, and two, stress was less because we used to know which patient is bad, which patient is good, because the monitors will bleep us, and even it bleep us in our gadgets, that's in our mobiles also we had software. So in that way the monitoring was very useful, and I think Dr. Vijay Kumar will highlight you about the exact use of DOSI system more effectively and technically, because he is a specialist in that.
COVID, we know like there was scarcity of beds in the ICU also, and DOSI really helped us like picking up the early warning signs, and they had early warning scoring system, and it helped in shifting the patient, like picking up which patient is going bad in an early kind of very early, and send them to ICU. That way, like you can pick up like which patient in among the patients, like which patient is like very critical, and you can shift the real ICU, and you can be prepared, and you can be avoid the adverse situation in those patients. That way, DOSI really helps in picking up the really critical patients.
Dr. Ramesh, pulmonologist, I'm a nodal officer. I've been watching this DOSI from the remote control place, or where our student was very, very helpful. The interface of DOSI is very nice. Immediate alarm will be issued, and those will be attended. See, if doctor will be having lot of pressures, they will be taking care of lot of pressures. During COVID time, we were restricted the doctors because the care and there was a rotation on duties. The doctor should have given off and other things. Each doctor, like one doctor, 6 beds or 5 beds we used to manage, and 6 beds, any emergency attend within a minute is to know. Otherwise, individually the doctor should go to the place, check BP, check pulse rate, and make sure that any problem is there. Then it takes a delay of 5 minutes. That delay of 5 minutes also was well covered with this DOSI. The interface system was very good, and it was very helpful for our patients, and also monitor the people outside, because the monitor was connected outside for the administrators and other people who used to come to know and tell what are the action to be taken place for the patient, and the immediate response was given. The patient was resuscitated, or drug was given, whatever the problems were solved immediately, and there was no negligence or any other chances were given, because it was totally monitored by the system. And sometime if doctor little be gone to somewhere, the nurses were informed about the monitoring blood rate, and they used to inform us. Like continuous monitoring was made in this during COVID system, and the DOSI Millennium Unit is really helpful, definitely helpful for the patient when it is in a large scale like trauma center, COVID crisis, or any other crisis which is happening in the future. It will be very helpful. Thank you very much.